Give everyone a minute to get logged on. Give everyone a minute to get logged on. Give everyone a minute to get logged on. All right, welcome everyone. We're very pleased to have you here at the Jacksonville Urban League Center for Advocacy and Social Justice Town Hall. This evening, we will be looking at mental health and youth, something that has, particularly during COVID, gotten a lot of attention. And we're very pleased to have some great speakers, some really experienced people who've dealt with this problem, and will be sharing their knowledge and skills and help us learn more about this very, very important topic. I'm very pleased on behalf of the Urban League that so many of you have signed on. It's part of our mission to share and make people aware of issues like this, particularly in communities of color. And we're grateful that we have such expertise locally. I also wanted to introduce Sophia Berger, our coordinator of interns, and I will introduce now Emma Nicole, who will be our master of ceremonies this evening and help facilitate this town hall. So Emma, take it away.
All right, hello everyone. Thank you for being here tonight. And I will go ahead and begin by introducing our panelists for the night. First off, we're lucky to have with us Mario DeCunto, who is a licensed mental health counselor and a qualified clinical supervisor, practicing in both English and Spanish with children and families in Jacksonville since 2009. He's a passionate advocate for mental health, serving as a panelist for the Jacksonville Children's Commission discussion on mental health stigma in the Hispanic community, and for the Jacksonville Human Rights Commission at accommodating employees with mental health impairments. Currently, he is active in the community as a board member of Mayo Clinic's Hope 2 Board of Directors at Child Guidance Center and Girls Inc. Jacksonville. Second, we are grateful to have Richmond D. Wynn, PhD, a licensed mental health counselor and certified addiction professional. He is an associate professor of clinical mental health counseling at the University of North Florida and is also the director of the counseling center on campus. He was recently appointed interim vice president and chief diversity officer at UNF. His research and community engagement focuses on intersectionality of identity and traumatic stress, with an emphasis on marginalized social groups and the ways in which culturally diverse LGBTQ people negotiate their identities and manage their health. And lastly, thank you for being here, Selena Webster Bass, MPH. She is a Jacksonville native with more than 25 years of experience in health equity, community health, and cultural humility. A nationally recognized health equity advocate, Selena has held leadership roles with several Jacksonville-based institutions. In 2016, Webster Bass launched Voices Institute, a training, consulting, and research group focused on advancing health equity in communities, organizations, and systems while promoting physical, mental, and emotional well-being in children, youth, and families. She serves as a core partner with SAMHSA CLC team, University of Maryland Institute for Innovation and Implementation National Partners, University of Florida Center for Equity, the Partnership for Child Health, Kids Hope Alliance, American Heart Association, Novartis Pharmaceuticals, sickle cell disease nonprofits, and other behavioral health organizations. In 2020, Selena held a national webinar with the CLC team on suicide prevention in Black youth. This year, she hosted a local Baptist Health webinar series, Resilience and Strength, focused on mental well-being in Black elders, caregivers, and youth, and a national webinar in partnership with the First Coast Black Nurses Association on addressing the crisis, suicide prevention in youth of color. Selena holds a bachelor degree of science in biology from the University of North Florida and a Master of Public Health from the University of South Florida. She is currently a doctoral student pursuing a Doctor of Ministry with a concentration in social justice and community organizing. One of her favorite quotes is, "Not everything that is faced can be changed, but nothing can be changed until it is faced." James Baldwin. So I want to thank all of you for being here today as we move into our question portion of the evening. To start, I will ask our panelists, what risk and protective factors for depression, anxiety, and suicidality do you all think are especially prevalent or specific to youth of color in the Jacksonville community? And if Mario, you want to begin by going first?
Sure. Thank you. And I just wanted to thank the Urban League for having us here today to talk about this great topic. And like Selena said, or as James Baldwin said, we do have to talk about the issues at hand if we do want to see change. And so I appreciate that. So the risk factors, and we also have some positive factors, both strengths and weaknesses in our cultures when it comes to mental health. Some of the major risk factors that we have is, unfortunately, there's a great amount of stigma, especially among Hispanics, and I know it's the same around African American community. We have stigmatized mental health for many generations, and so people do not want to be considered crazy. They do not, it's probably one of the worst things to be, to say you're seeing a psychologist, or to say that your child needs a psychologist. So for a lot of parents, issues have to get pretty bad for children to start receiving services. Now, some of the strengths, on the other hand, is that there's a lot of family cohesiveness, and that goes for both our African American and our Hispanic communities. We have a strong family unit, and that that goes across all cultures, but the Hispanic community is known for looking out for each other and making sure that people are well. But when you factor in some of the other issues that we have, there is a great disadvantage when it comes in. And I pulled up some numbers as well. When you're looking at healthcare, for example, in Duval County, Hispanics are well underinsured, for way less insured than any other cultural group in Duval County, and that is a huge barrier to services, as well as being much lower. They make about $10,000 to $12,000 less overall than their non-Hispanic white counterparts. So that is another huge barrier to be able to afford out of pocket, which is what they'd end up having to do. as well as, well, we can go into schools about figures about schools and the challenges that Hispanics here in Duval County face in schools as well. But I don't want to take up all the all the time on that. But later I'll go over some of the slides I have and just show people some of the discrepancies we have. But I hope that helps answer part of your question. Did I get all the points? Thanks very
Yes,
much,
that was
Ann.
great. Thank you. Richmond, if you'd like to go next.
Okay, I had some of the same thoughts as I knew we would, because there's some synergy here between the panelists, and I enjoy that. What I would add is, in terms of risk factors for depression, anxiety, and suicidality, is traumatic stress. And we look at traumatic stress in this generation, and we look at multi-generational traumatic stress. And what that means, if you look at the history of exclusion, the history of marginalization and discrimination and oppression of our ancestors in this country, Black and Brown youth, as they come to understand that from a historical perspective, we are more prone to internalize that. You know, we enjoy and both and are affected by the oral tradition in our cultures, meaning we pass down history and information by storytelling. And we may not have family crests and books that get passed down from generation to generation, but stories do. And some of those stories are really traumatic stories, very stressful stories. For instance, my mother grew up in rural Georgia, and she is the daughter of sharecroppers. And the lives of sharecroppers are not that great, and were not that great when she was born, and grew up wanting to go to school but couldn't, and had to work in the fields and do all those kind of things. And so she would always tell us those stories. And so I internalized those stories and her experiences of how she saw the people who were oppressing her family. In addition to the historical stress and the historical trauma that gets passed down from generation to generation, we have our own experiences in this generation. If we look back at, the most challenging and the most traumatic things that have happened, particularly for young men, young Black men, in our relationship with law enforcement over many decades, but certainly over the last couple of years, just watching someone die at the hands of a police on television, on camera, is traumatic to me, because the person who was killed in the street at the hands of an elected, of a hired official, a public servant, looks like me. And so it doesn't take much to say, well, that could have been me, and it still could be. And so even though that has not been my experience personally, there is a connection with the people who are experiencing those things, and they look like me. So now that raises my level of anxiety, and I'm what we call a hypervigilant. I'm constantly sort of looking over my shoulder and watching out for, is this person safe? And is this particular person in a blue uniform, is this person safe? Is this one? I hate to say it this way, but one of the nice ones. And so we can walk around with that level of stress, not knowing what's a safe environment, what's not a safe environment. And that contributes obviously to anxiety, depression. Anxiety and depression are tied together. The other thing I will just touch on briefly, and we'll come back to these points, I would imagine. And that is the intersectionality. You heard in my introduction that my research interest is in intersectionality of identity, and that is how we all have multiple identities. And when we have one or more identities, social identities, gender, race, ethnicity, sexual orientation, gender expression, ability, socioeconomic status, and the list goes on. When one or more of those identities has historically been marginalized and oppressed, when there have been laws written into and codified, this oppression has been codified into law from the highest land in the country, that multiplies and contributes to the feeling of depression, feelings of stress and anxiety, and can be overwhelming to the point of wanting to check off the planet by killing yourself. So all of those things are risk factors, and conversations like this certainly help us raise awareness of how oppressive practices and laws and behavior can have these kind of very, very serious negative effects. I'll yield the floor to Selena.
Yes, thank you.
Yeah, along that same vein that Dr. Nguyen was talking about in terms of intergenerational trauma, I really think that racial stress and trauma is something that we undermine. We talk a lot about adverse childhood experiences and ACEs in terms of neglect of children, or having a parent that's incarcerated, or being a child of a divorced relationship. But, the racial trauma that Dr. Nguyen mentioned is real. When we think about our headlines of Trayvon Martin, of George Floyd, of Michael Brown, these images that young people are watching on social media and watching in the media, it's impacting their sense of self-worth, their sense of self-efficacy. And so I think that's an important risk factor that we need to talk more about, and create gracious spaces for young people to share what their thoughts are around these incidents that are happening in our communities. Other risk factors may include prior suicide attempts, socioeconomic status, economic insecurity, having access to lethal means in terms of, dying by suicide, as well as having a family member that has died by suicide increases the likelihood that someone may lean towards suicidality. I have a very close friend whose son locally here died a couple of years ago by suicide. He was a bold student. And, so it's really important. She's found to make sure that her family is in counseling and, seeking out professional support as they journey in their grief process. So those are some of the risk factors in terms of suicide for youth.
And as firstly, I'm sorry about that for your friend. And I did want to show some of the slides I had on suicide, if just to show some of the numbers we're seeing in Duval County Public Schools in the last youth risk behavior study that they did, if that's okay. Is that okay?
Absolutely.
Okay.
While you do that, Mario, I was going to just throw in that I know we've heard a lot about bullying among youth, and we didn't mention that word, but certainly bullying, peer-to-peer bullying, and is adult to youth bullying sometimes as well. Right.
Are you seeing all this?
Yes, we're seeing it.
Yes.
Okay, so as we were saying, this is the barriers one that we were talking about. Risk factors, we'll talk about that a little bit later. But just as you were talking about, Dr. Nguyen, bullying, right here, they asked children over the past year if they had experienced bullying, and our Hispanic children, it was 9.3 points higher, and double what we see on the statewide average here in Duval County. Children who seriously considered suicide, 7 points higher in Duval County, 9.3 points higher than the state average. Attempted suicide, nearly 24% of the responders of the 3,000 children that were asked, 24% of the Hispanics that responded to this survey responded to that, and that was twice as high as their Duval County peers, and 2.5 times higher than the statewide average. Children who did not go to school due to feeling unsafe, And this was in 2000. This was published in the 2011 YRBS and posted in the 2012 Hispanic Health Report. Didn't go to school, 8.4 points higher than their non-Hispanic white peers, and they were that and 11 points higher than the statewide numbers. And I'll show you the actual numbers where I got this from. As you can see, much higher, much more risk factors for our Hispanic students here in Duval County, and we only have increased our concerns, especially after the last 4 years, where we have seen an increase of hate crimes, bolstered confidence among racial or racist remarks against Hispanics. There was a horrible shooting where about 30 people were killed because of something that an extremist had said after a presidential speech about Hispanics. Unfortunately, a man went into Walmart targeting Hispanics because they needed to go back to Mexico, was basically, so this is what our students are dealing with. And we don't even have the most recent YRBS numbers now, but it is a major concern. And when children don't know how to cope because their parents don't know how to cope, then we're going to have problems. As the numbers of the health report also showed that Hispanics had higher use of alcohol binging, lower access to insurance and medical care because of cost. So all of those things compound each other when you don't have where to go, you don't have people to express yourself to, because most of the services are not in your language. A lot of those problems are going to be internalized and unfortunately can be quite negative. But I'm going to stop sharing here.
Mario, you talked about the youth not knowing how to cope, and I was thinking, not only is it sometimes because the parents don't know how to cope, but youth are watching other adults, not just their parents, but they're watching television. So it's almost like the news is a risk factor for depression, anxiety, and suicide. I know I have cut back severely on watching the news and consuming news. And so young people might be getting it from social media, but they're being exposed to, unfortunately, many of our elected officials are really perpetuating these kinds of stereotypes and outright negativity and oppressive speech, and promoting policies that are oppressive toward different groups of people and people that look like us and look like you that are struggling. And where do you go? You can't watch the news, you can't be on social media without being bombarded by these things. And so it is our responsibility as adults, I think, and particularly people in the public eye, and have, the people that we elect and pay, they really should take greater responsibility for their speech, their actions, and their deeds.
Absolutely. And Dr. When you mentioned about children watching their parents, the research shows us that strong family support and relationships that's one of the protective factors for suicidality. And I think particularly with the compounding effects of COVID-19, the social isolation, racial stress and trauma, we have this layering that our families' economic distress. It's so important that parents and caregivers are checking in with their children, because they don't wear their emotions on their sleeves, and just asking, what was the best part of your day? Or, what did you like most about school today? Or what was something that made you laugh today, right? So, really cultivating those relationships, particularly during this time, so that youth feel valued, that they feel important and heard. So I think that's important in terms of protective factors. Also, religious and spiritual engagement has been shown to be a protective factor as well. You know, having shared traditions and beliefs and having, you know, community is so important, and having that membership, that group membership is another protective factor, as well as, you know, community supports in terms of just being connected with your peers and in the band or with, you know, some type of step group or whatever it is, you know. So so these are factors that we should lift up as well. We talk a lot about, you know, those factors that increase susceptibility to suicidality, but what can we do so that our kids feel loved and valued and supported?
Mm-hmm. Add communication to the list in terms of youth, respecting youth. It is up to the adults to create an environment where youth are empowered to speak their truth, and to do that in a way that, you know, is really clear about what they're experiencing. And if they're not clear, we can help them communicate, but they need to know that it's safe to for them to express how they're feeling, what they're thinking, what their experience is. Because one of the problems with suicidal thinking is that people, youth and adults alike, don't believe that they can open up to another person, to their parents, to a significant other, about what they're thinking and feeling. And so they're holding all of this stuff in, and then suicide becomes more attractive as a way to cope. So it's up to us to create the safe space.
Yes, absolutely. Voices, we've been conducting these sessions called Crossroads with boys and girls clubs and youth groups around the city. And we started these discussion groups with young people because of the social isolation of COVID-19 and the racial stress and trauma. So they started right after the George Floyd incident. And the initial sessions were virtual, just so that you could have a place to convene, to gather, and to, you know, again, have that gracious space to talk. And, you know, one of the things that has repeatedly come up in those discussions is, you know, grief and loss. A lot of our young people have lost loved ones to COVID-19, and they have not had the space to really talk about that emotional response to loss and to death. And so I think that's another important topic that we need to address. We have a lot of orphan children because their caregivers have you know, died from COVID-19. So that's one thing that comes up. And then that theme of what you just mentioned, Dr. Nguyen, where do we go to talk about, who do we reach out to when we need help, right? And so the goal of those sessions, one was to provide that gracious space, two, to provide coping strategies. So we taught mindfulness and breathing, and we talked about pet therapy and how oxytocin is released, you know, when you connect with your dog. And so we had kids showing us their dogs and pets on the screen. You know, it was really exciting. And then even the use of music as a way to shift moods, you know, because that's a part of their culture, is, you know, what they listen to. So so we've been conducting these sessions more so now in person since we've opened back up, but it's really been enlightening and transformative, even for me as an adult, to watch and to hear the hearts of our young people.
I love it. My dog is right here.
All that good oxytocin being released, right? Yeah.
Thank you, guys. If you're ready, we can move on.
You see, we're all over the place, Emma.
Oh, it's great. I love it. Let's see. The second question, I feel like we covered a little bit of it. It's, what barriers do you see to youth of color accessing quality behavioral health treatment? So beside those risk factors just for the mental health issues, what are barriers that you see to them accessing that treatment?
And I'm happy to start again. You know, as we had mentioned, Emma, I think you know, our our Hispanic community being the least insured of all cultural denominations in Jacksonville, as well as having about 1 in 5 Hispanics claiming that they could speak English well, is a huge barrier. Not only that, adding that the professionals in our community are very well-meaning, but when they don't speak the language, it's very difficult. And I don't know if any of you on the call right now have ever tried to ask for an aspirin when you're in Europe or in Mexico or anywhere.
Mm-hmm.
And imagine what it would be like talking to somebody on a weekly basis for an hour when you can't even ask for an aspirin. So it's like then you're dealing with translating phone calls and translators that don't show up, and now everything's gone virtual, and a lot of our folks are technologically disadvantaged. So, and I think this question goes in a little bit later when we talk about COVID-19 and all the problems there. But that's a huge problem when you're talking about all these factors that you need to, hoops that you need to jump through, and hurdles that you need to, to jump over to be able to access care. And then our providers are so overwhelmed right now because a lot of folks don't know, but Medicaid is still paying providers, what they were paying them in 1993. They haven't raised the rates for someone who has Medicaid to charge. So do you think there's any real reason for a provider to see a Medicaid patient? No. So then there's one guy that sees Medicaid patients, and this is a huge barrier, so then you're on a waiting list. And then the guy who does see Medicaid is probably an intern. So then you're dealing with someone who's not as experienced as they could be.
Mm-hmm.
So, the state needs to wake up and needs to pay professionals what they're worth so that we can get quality services back into the major, mental health clinics, and make it feasible again. I wish I could buy a car for what it was worth in 1993, or a house, but imagine somebody from 1993 trying to buy a car or house today on those wages. They can't. And so that's what the problem is. We're even making it, we're creating these barriers that are, and then we blame people for not getting counseling, but we are creating these barriers through financial, economical ties that go all the way up to Tallahassee and our state representatives and all those people we voted for. And we don't even realize how much they're affecting the quality of life of all the people around us. Because you may say, well, I can afford seeing a therapist because I have the money, it doesn't affect me. Sure. But when you get hit by a car by somebody who's having a mental health breakdown because they couldn't afford, or your son gets shot by somebody who couldn't get access to care at school, right, then you start realizing that you can't live in a walled community. You have to be able to, everyone needs to have equal share and equality when it comes to healthcare access. So anyway, I'll get off the soapbox. But thank you. That was my answer.
Thank you. Richmond, if you'd like to go next.
A very comprehensive answer, Mario. I had some of the same thoughts again, is lack of access, and not only with money. You certainly covered that thoroughly, and I think that applies across the board, but also location. And where, and which speaks to the not having maybe enough money to have your own transportation, and having to go to services across town, because in certain neighborhoods there aren't healthcare services, and certainly mental health care services, so you have to go across town to access those services. So access is also includes geographical location. Another thing I think is important, and it's really important to me as a counselor educator, is the inconsistent culture-centered approaches to counseling. And we are taught to teach counseling I'll say what I used to say in my classes, we teach Freud and the boys, so Sigmund Freud, the father of the psychology, psychotherapy, and everybody, all hail Sigmund Freud. But, back when Sigmund Freud and the boys, and I say it because they were mostly white men, upper middle class, heterosexual, so on and so forth. Those were the men who developed counseling theories that we still teach to this day in counseling programs that did not take into account that the women's mental health, didn't take into account people of color and our unique experiences and challenges. And I taught a course, I used to teach a course in human development. It's a standard in every counseling program. Everybody takes the human development across the lifespan. And that is where you get Freud and the boys and all those people. And I would say, well, I have found a wonderful book that taught human development from a relational cultural perspective. And so the first chapter covered Freud and the boys, and then the rest of the book was, I used to say, well, Freud and the boys is what you need to pass the licensing test. The rest of the book is what you need to be an effective therapist. And the rest of the book was on gifted development. So our gifted youth have a particular culture and a particular language and particular life experiences that we need to be sensitive to as we approach working with them. Women's development, men's development, LGBTQ development. And there were all of these things, and this book was just so amazing. Unfortunately, it is out of print, but it was amazing because it moved us to a more culture-centered, culture-focused approach to understanding human development and evolution. It helped us understand how to craft culture-centered interventions. I was excited last week, I believe it was, or maybe the week before, when a teacher was recognized. I think that was here in Duval. I sometimes get my stories. I do watch some news, and sometimes I get the stories mixed up, whether it's local or national news. But there was a teacher who won an award, or was nominated for an award for teaching her creative ways of teaching math. And a lot of people have math anxiety, and it's not that they're not good at math. It's that they just have anxiety, have preconceived notions about what math is, and math is a different language. And so she got very creative. And so she worked with her students to create songs. And I think about how I learned my ABCs and other things. We did it by singing them. And so she created songs. They worked together and created songs. They created little competition with different small groups in the classroom to come up with the most creative way to learn a math principle or concepts. And she stepped outside of the traditional, she stepped outside of probably what she had been taught in terms of ways to teach math. And she really connected with what was important to her students. What would her students, what would make them resonate? What would make this issue and these concepts resonate with them? So I think in counseling, we have to do the same thing. I've taught the traditional stuff for years, and we have to think about how do we tailor this to the person or the group that's in front of us? How do we connect with them in ways that will make this experience come alive and will resonate with them, and so that they trust us and they will be able to use counseling for the resource that it's meant to be. If we stay in our place of the way that we were taught and sort of the way that the only way that I know how to be a counselor, there's bound to be some disconnect. Clients may not trust us, and they may even know why they don't trust us, and we become less effective. So I think certainly a barrier to Black youth accessing quality behavioral health treatment is the lack of culture infused in the counseling process. They don't see themselves, they don't see their culture, they don't see how they can connect in a way that feels authentic to them.
Yes, I agree, Dr. Wynn. I think we need more culturally responsive providers, and not only providers, but also some of the assessment tools that are used with our young people are not culture specific. And so I think that's another issue, and many of our young people end up misdiagnosed and pushed into other systems such as the juvenile justice system, when we look at the disproportionate number of young people that are, when I say young people, I'm talking about preschool youth that are suspended and expelled from preschool, and then pushed down that trajectory of the juvenile justice system, it's significant. And so, we know that youth that have juvenile justice involvement, 70 to 90% of them have experienced some form of trauma. So, are they in the right system? Are they getting the services that they need? And the data shows us that they aren't, that oftentimes Black youth are receiving service inpatient versus an outpatient and community-based services. And so I think that's another barrier to accessing mental health services. The other thing is that there are a few studies that show that Black youth, particularly Black males, may demonstrate their depressive symptoms in a different way. So they may describe it as a stomach ache, or more somatic than I'm feeling blue today. So even the way that we recognize symptoms of depression may be different culturally, and based on race, ethnicity, or socioeconomic status, or even other cultural factors.
If I could just jump back in and tack on to that, I just had this conversation last night about Black men in particular, expressing depression as frustration and anger and even rage. And I was talking with someone, and we were talking about a person in particular, but and this person it's just all of this violent language, and I just said, gosh, it sounds like there could be some depression there. And I was talking to my sister, and she said, well, what are you talking about? Depression is not feeling blue, or hypersomnia, or lack of appetite. Those are the classic symptoms, and all those things could be there in some way. But I think we miss out with depression or any other mood disorder when it is this anger and rage. And we just think, oh, the angry Black man, but really it might be, it's anger on the outside, but there's something else going on the inside. And I would first start looking at symptoms of depression. I would look at traumatic past, and I also would want to know, how does that anger and rage work for you? How is it functional? And what does it do for you? Because once I can understand that, then we can find other ways to meet that need. But first, we want to know, how does it work for you?
Thank you guys for touching on that. Next, on kind of a similar topic, I was going to ask, so I know we all know we're living through some unprecedented times with the ongoing pandemic. So in what ways do you see the pandemic disproportionately affecting youth of color?
And I hate that we keep jumping ahead because we're just so eager and everything does blend together. But as we were saying earlier, there is a huge technological disadvantage when it comes to services being available only online. A lot of health providers are coming back to being live, but unfortunately, because there's more people reaching out to mental health providers because of the greater need, we've kind of uncovered the nasty secret here in Florida, where we just have too few providers, and that goes for all the health areas. We have some of the least amount of doctors in Florida than most states. We have very few, and people don't really notice it because they go to the doctor, they're fine. But the truth is that compared to other states, and that's why people were so worried during COVID to not get infected because of the lack of services that we have. But now with mental health, unfortunately, we're seeing the issues, and unfortunately, because of the stigma as well, a lot of people aren't getting access to the services, and it all just kind of comes together. People being afraid to reach out to mental health providers. Those who do need it can't access it because there's either none available or they don't take your insurance anymore, because a lot of people don't take, Blue Cross Blue Shield anymore because they're getting the same kind of problem like Medicaid. Somehow insurance companies are boasting huge winnings, but I don't understand how, and the hospitals are all talking about, not having money, and I don't understand where the money is going, but the providers themselves are definitely not seeing it, and the people who are paying these huge amounts of money, at least for my employer, I know I'm paying lots of money for my family to get insured. Something's going on there, and I know I always go back to the soapbox, but it's actually really among all of us here that we don't realize how much we can make a difference when it comes to the quality of health services in our state, by contacting the folks who actually control a lot of that. Here we are, all of us fighting over, a crumb of cake. And, meanwhile, we don't know where the rest of the cake went. So anyways, just to put it into perspective, I think that's basically what it boils down to, is access of technological resources, monetary resources, and of course, the language barrier.
Mario, the rest of the cake is at the top. And the cake, the rest of the cake is taken off the top before the crumbs even get to us. So that's where the money is. It's basic math. The only thing I will add in here is, that COVID-19 has certainly compounded the issues and concerns that we've already been discussing. And, we tend to point to the isolation from, the health guidelines, social distancing guidelines. And while all those things are, certainly the things that we needed to do, but it obviously had an impact. I listened to our students talking about the challenge of online learning and not feeling as connected. And so if you go back to what we've been talking about and now add on being isolated, the anxiety around, am I going to catch this thing or not? And if I do, am I going to die from it? Or are my family members and loved ones going to experience this? Selena mentioned earlier about grief that young people are experiencing from friends and loved ones who have died. Or I will even include maybe not only from people that they know, but people who just look like them, who have died from COVID, and they could be experiencing this a grief from that as well. One thing I thought about in this is that we work a lot, and I would imagine everybody on this call, that you're here and you're committed to diversity, to equity and inclusion, but it's the belonging piece. If you've seen the DEI plus B, the belonging piece, we can make sure that we have representation and adequate representation. That's diversity. We can make sure that everyone has equal access to resources and addressing some of the issues, all of the issues that Mario talked about. And we can even make sure that around the decision-making table, people's voices are included, but there's something else. There's something about creating a space where people feel that they actually belong, that they can show up as themselves, they can be their authentic selves and feel welcomed. That's a little bit different from just making sure we have the head count in diversity, that we have equal access, and that we invite people around the decision-making table, because you can contribute to a decision and still feel like they don't really want me here. So it's the belonging piece that I think is so critical. And especially on the heels. Well, we're not really on the heels of COVID-19. We're still in it, but we're in a different phase of it. And with the isolation that young people have experienced because of that, I think the creating a sense of belonging is so very important. So that to add to the diversity, equity, and inclusion, we want to make sure that we are creating spaces where people can show up and be authentic and feel comfortable in their own skin.
Absolutely. The only thing I would add in terms of the impacts of COVID-19 on young people is missed significant life events. I know that my daughter graduated last year, and there were some events that, she wasn't able to attend because we didn't want to, take that risk. But, during the pandemic and during the adolescent time, connection is really important, getting with your crew and, being with your peers, that's part of their identity. And so I think we sort of missed that, with, birthdays and graduations and proms and, having to adjust and limit gathering with friends. And so I think it's important, again, from the caregiver lens, parent lens, to be creative, whether it's using Zoom chat, video chat, family phone, whatever it is, in order to help meet that need, with the preventive precautions that we have in place. The other thing I wanted to piggyback on was the shortage of providers. I think a lot of communities are moving to a collaborative care model where primary care providers are being trained in identifying youth that may have depression and suicidality, and learning how to manage those youth, with guidance from a trained therapist or psychiatrist. So, I think we have to think, how can we integrate systems? How can we be more effective in the primary care system, working with the behavioral health system, working with mental health providers to address the needs of our community. So I just wanted to add that as well.
Thank you, guys. For a final question, I would just ask, I think it's important that we also address what are some examples of the intervention or community resources that can support youth of color who are struggling with their mental health or contemplating suicide?
Well, and I don't always have to go first.
Well, it's the last question, Mario.
Might as well.
The pattern. Nice.
Keep your pattern going, right?
Now you made me forget what I was going to say. But no, I think for the first thing I wanted to mention is make sure that we start to destigmatize mental health. It's very difficult to undo generations of beliefs. But I'll tell you one thing. I was with a family who their daughter was questioning her sexuality. And when Congress and the president, when it was President Obama, made marriage legalized marriage for all people in the United States, the parents actually said, well, the government says it's okay, then we're okay. But this is a Hispanic, very, very Hispanic family, very little English. And they had a huge problem with it, from religious to cultural to just every factor you could imagine. But when you have one big factor, that's when you have the government and you have the examples of our leaders showing that there's acceptance on a national level, that makes people start to question their own, antiquated ideas and saying, well, maybe we need to get on board with our daughter and support her because the president said so. And so all of a sudden, It was just one day to the next that it happened. And I couldn't believe my eyes when I saw just a shift. So this is what we're talking about. When we start seeing changes in our community, when we start seeing changes in our schools for people, our principals and our superintendents showing more acceptance to mental health, and a huge one, what we need to stop doing from day one is stop limiting people who have seen a mental health professional or have a diagnosis from being able to go to the military. You know, we cannot make people who seek help all of a sudden become blackballed from the military. That's just a horrible thing. And the problem is that the ones who don't seek help because they're afraid are the ones who need it the most. And then they get in the military and then they come out. And unfortunately, we see soldiers dying when they come home, 20 suicides a day.
Mm-hmm.
They don't die when they're out there. They die when they come back because they were never given any coping mechanisms to handle all of the trauma that they faced from when they were children all the way to the military, and now they're back home. And now they're facing all of those things on their own in a dark apartment with, you know, the horrible VA that they can't even get an appointment because they got to wait 6 months. So, you know, this is what we're talking about. We need to start one by one, all of us, making a more welcoming, and like Selena was saying, like Dr. Wynn was saying, we need to be the examples of those people and be welcoming. And when a friend of mine just told me just a few weeks ago, love them where they are.
Mm-hmm.
Love your children, love the children around you, love them where they are. They may not be the perfect people, they might not be in the stage that you want them to be in. They may not be, you know, doing everything great in school, but you just need to love them where they're at, because these stages change so quickly. And sometimes we as adults focus too much on the details and we forget that we need to love our children where they are, who they are, and for who they are. So anyways, I'll leave it at that.
I like that emphasis on the structural barriers to mental health, getting mental health care. It reminded me of a student who was a nursing student who wanted to go in the military, and he was just in a really, really bad place. And he just did not want to go to counseling because he wanted to go in the military. He also wanted further in his future, he could see having security clearance. And he says, if I have it, not only if I have a diagnosis, but there's a question on an application somewhere that says, have you ever sought counseling? Not that you have a diagnosis, just have you ever sought help? And that was a barrier, because then he didn't want to lie, but he also didn't want to he didn't want to have to tell the truth if he had seen a counselor, because he was going to be pursuing a position that would need security clearance. One thing I'll add is, as an intervention, is one of my favorite things to talk about, and that is the mental health continuum. Most times when we say the phrase mental health, most of us think disorder, diagnosis, the C word that we don't use a lot, but I'll just say here for reference that some people use the crazy word. We don't use that in mental health, but some people do. But mental health is really, we're talking about a continuum from health and functioning well to not functioning well to disorder, diagnosis, disease, and all of the phases and stages in between. We all have some mental health status. Everyone has a mental health status. Where you are on the continuum is a different thing. And we don't want to stigmatize where people are on the continuum. And we want to make sure that people know that they can move. If they're not happy where they are on the continuum, then there are resources, including people and self-help resources, to help them move to a different place on the continuum. So I like to think of mental health and compare it to physical health. I like to think of it as mental hygiene. And if you think of the word hygiene, most of you have already started thinking about something physical, right? You're thinking about, oh, when's the last time I took a shower? When did I brush my teeth? When did I comb my hair? For those of us who have hair, I can talk about the last time I shaved my head. I actually have hair, I just shave it off every day. That's part of my hygiene routine. So just like we all have a physical health, physical hygiene routine of some sort, it is so important to include mental hygiene, a routine in this. So I like to ask the question, when is the last time you've brushed your brain? When have you reflected on your thinking? When have you took time to think about your thinking? That's brushing your brain. When is the last time you flossed your heart? When have you reflected on these emotions and feelings that are a part of your everyday life and thought, is there another way to manage these things? And where is this coming from? And what are the events in my life that are converging and bringing about a sense of loneliness or a sense of anxiety, a sense of depression, or a sense of joy? Maybe we need more of that. And so what is your mental health, your mental hygiene routine? How do you look at your mental health on a regular basis and attend to it so that it doesn't wind up becoming something that creates difficulty for you, that impacts your relationship with yourself and your relationship with others? So that would be the
I love
intervention.
that. I need to brush my heart. I love that. Yeah, so in terms of interventions, Jacksonville has been really committed to promoting youth mental health first aid from an educational perspective. And I think community education is so important because we need to normalize conversations around mental health. So, so yes, continuing the work of youth mental health first aid, adult mental health first aid, but there's also teen mental health first aid. And that's something that we have not implemented yet in our community. And I think it's an intervention that amplifies youth voice, because then youth begin to have conversations with their peers around mental health and learn how to recognize signs and symptoms of mental illness. So those are community-based interventions that I think are really important in terms of keeping our children whole. I think about the African proverb that says, children are our reward, and if we really believe that children are not just our namesakes or just the bearers of our name, but we really believe that children are not our future, but they're actually our present, right? That we should make the investment in their mental well-being and supporting them in terms of their mental health and well-being. So.
Thank you all so much for your insight and your expertise and for being here today. I'm so appreciative. We're also appreciative for your time. I'll turn it back over to Dennis now. I know he had some closing remarks. Oh, and if anyone has any questions, feel free to put them in the chat or unmute yourself if you'd like to ask a question as well.
Just thought I'd wait a minute in case there were any questions, but all right. Well, I again wanted to thank our speakers for presenting this evening. Just express on behalf of the Urban League and the people of Jacksonville, my gratitude to the three of you for all the work you're doing. It's so critical to our youth and to the rest of us to learn how to understand, have empathy, sympathy, and love for those who are challenged. And again, it's just great to have you doing what you're doing, and we really appreciate your appearing this evening. A recording of this will be on our YouTube channel, the Center for Advocacy and Social Justice of the Jacksonville Urban League. And we encourage you to share that. And there are many other videos on there that could be helpful to others that reflect other inequities in our community. And also want to thank Emma, Nicole, for all the work she did to put this together, as well as Sophia and our other interns at the center and the staff of the Urban League. And last but not least, our president, Richard Danford, who's been a big supporter of our center. So with that, we'll say goodnight and happy holidays, and look forward to seeing all of you in future presentations, town halls. Thank you.
Thank you.
Thank you.
Thank you. Take care.
Thank you again for inviting us. It's
Yes.
a pleasure.
Thank you very much.
Good night.